Speaking of quality and speaking of price, especially, why is dialysis expensive?
I learned this a couple of years ago when I first got out of the healthcare system before Patrick and I started this company. I was working with a guy who was building an all-risk health plan in South Florida. And I was doing all the direct contracts with the providers to build out the direct contracting model. And sure enough, I got to talk to the nephrologist. And so the nephrologist, the actuary said they should have been paid like $1.20 per member per month. They got furious. They threw me out of their board meeting. The reason why is because nephrologists there's not many kidney problems out there other than dialysis. But the fact is that after 18 months on dialysis, the government takes over your cost. So Medicare takes over. And so what happened in the late 60s, early 70s, this is my understanding, having talked to nephrologists, is that we used to have home dialysis. Why? Because Medicare paid for it. So there were companies out there creating at home. They bring sometimes in a van and they bring it to your house and they would give you the at-home dialysis. Well, it's obviously better for a patient to be staying at home, and especially in this day of COVID, right? Not getting out and because they're delicate patients. And what happened was the Medicare was obviously lobbied because there's no reason to switch off something that was working. And they said that they would no longer pay for home dialysis. So at that point, all the big systems got involved. Hospital systems started doing dialysis. They had dialysis units. What's happened in the intervening, I'm getting old, 50 years, is that two companies have taken over the dialysis market, and that's DaVita and Fresenius.
Yeah.
And they've gone up and they've bought up the dialysis units at all the different hospitals around the country. So there's really just two options in any market you go to. There are very, very few independent dialysis units. They charge astronomical amounts. So you get dialysis, you're working for an employer and you have insurance. My understanding is it's 5 figures, and I'm talking like 50,000 plus per month. Some cases I've seen it up to $200,000 a month. And they're billing like crazy because they know at 18 months it flips onto Medicare and it's going to go down to the ground. And so their business model is predicated on being able to aggregate the market. Medicare is not paying for home dialysis, so there's very little interest in industry to create the technology, recreate the technology, and business models to support home dialysis. And so because of what the government does, we've allowed two companies to create a duopoly, and all the bad that goes with that. They have, basically carte blanche in making pricing decisions. Everybody has to go to them. There's no questions asked. You just shut up and get in line and pay the bill, damn it. And if you don't get to come here, you die.